The Health District, the Fallbrook Regional Health District Government and Public Engagement Committee is being convened Wednesday, August 19th, 2026 at 5:30 p.m. Roll call.
We have committee.
Thank you. And then moving to public comments.
No public comments. We didn't receive anything via email, and we have no one else on Zoom.
Very good. Discussion items, message and marketing, and mission statement review.
Right. So just to circle back to the way back machine.
Okay.
Sorry.
Okay. Oh, that's not it.
It's okay.
Proceed.
The team met quite a while ago, and we really had a whole conversation about the point of our programming, the pillars in which we would focus those programming, and really making sure that our messaging is less about the event, but we're here to help with your lifestyle. We're here to help around major initiatives, right? So that's what this document is built upon. So we'll talk about the mission statement for point B in a second, but point A, message and marketing. We really kind of centered on small steps, lasting change, really to outline the idea that you don't have to change everything today, because that doesn't work. You know, that's why New Year's resolutions fail.
That's right.
But if we can get you to do one small thing today, so when you go down to the core brand messages, we're talking about communicating these throughout the year. Better health begins with one small step. Healthy habits create lifelong wellness. You don't have to do it alone. Again, that's really pointing to our program coordinators. Prevention is empowering, getting people to want to own it for themselves so it doesn't feel like it's being pushed on them. We know that that will be especially important when we start talking to families, right?
Yes.
People will want that intrinsic motivation to help support their family's health, not just their own. What that will look like when you'll see on page 2 is that the team is already working to put together a year-long calendar. So 2027 will have a full calendar where each quarter has essentially its own primary focus, but that still fits within that one year-long storytelling. So it's one consistent story with like 4 different chapters, if you will. But those factors are integrated. So that my small step story, and some of these titles and such will likely change, but this is just to give you that idea of the type of messaging and engagement you're going to see with the community.
Great.
So those 4 pillars and buckets, going back to our pillars and bucket days of Mike Stanisek. Beautiful. Eating well, moving more, feeling better, which includes a lot of our mental health support, and then thrive together. And that's really working from community and family, talking about that preventative health. We also have some very basic KPIs in here, knowing that that has to be part of our efforts. As board members, you know that is also built into my CEO goals for the year. So this is a consistent messaging across not just communications and outreach, but also across programs, so that we're being fully integrated among all parts of the district's language. Increasing our awareness, we have some specific metrics that we're looking at for that. Growing participation, obviously that's an easy thing to track. We already tracking more. Deepening our engagement. We're looking at some particular campaign style events. They may not be huge, giant community events. They may be smaller and focused around a specific program type or a challenge that we're going to do for 1 month, according to one of these basic pillars, something along those lines. Strengthening partnerships, again, that's that same language. Building trust, and then improving retention. We should be able to see quite a bit of good data on that as more and more that starts to be utilized through HubSpot, the CRM. So really the whole point of all of this is then to eventually build to that revised mission statement. So, but before we go to that, any thoughts or questions or suggested edits on message and marketing from the small steps lasting change down on your hand.
I'd just like to speak to the viewfinder. I feel like this is our next iteration of the community viewfinder of us, and it's not a giant map.
Right.
It's like, oh, here.
Yeah.
Here's what that is. And I think that's going to pay off in terms of spread of message, and also just help staff with the complementing of these different pieces. And that provides like velocity of messaging. And
Yeah.
so it resonates with me. What are you seeing?
Yeah, I mean, I like the four other pillars.
Mm-hmm.
So, I mean, I can see different programming visiting in separate ones and also interchangeable. So it's not just specific, like losing weight, you know,
Right.
It's like several ones can be interchangeable. So yeah.
And that was also important that the pillars were broad enough that we didn't have to take one specific initiative and be like, okay, here's the Spanish language one and here's the English one. No, the messaging is the same. The wording and the feel to the messaging will be tailored more to the appropriate audience, but it's still within that same core pillar message, so that we're not.
It's got its own container.
Yes.
Yeah.
Yes. But we also wanted to make sure that our Spanish language programming isn't somehow different.
Right.
Right? They're integrated. They fit and are working to solve some of the same challenges, but with just different languages that are more appropriate based on the attendees who are going to come. So whether our programming is focused on families, whether they're focused in Spanish language, whether they're focused on any specific kind of demographic group, they can still fit. Everyone kind of can talk about healthy habits, creating lifelong wellness. Yeah. Everyone we can promote move more with everyone. Because let's face it, it doesn't matter who you are, you probably need to get your activity level up. If you don't, well, then you're probably going to be teaching with us. That was the thought on that. So this is still has a lot of detail that will work into it. Teresa and her team is already well into that planning. So we'll bring that information back to this committee so that you'll see at the next meeting, this is August. So in October, you'll already see the first quarter that her team has spelled out for the calendar year 27.
Okay.
And that's done specifically so that Jasmine has a full 3-month lead up to when we roll out the next thing. And that should take away a lot of the reactivity that Jasmine is constantly on the hamster wheel with. Yeah. That gives her some freedom to do some longer term, more complicated things. But that also makes sure that Teresa and her team have all those details buttoned up. There will still be plenty of flexibility in there because we know things will happen. Instructors will not be able to do something or some new opportunity presents and we want to find a way to fit it in. I think those opportunities will be easier to adjust to when Jasmine's not like, okay, well, I already have 40 flyers for next week. That should help make a difference. We've been giving both Henry and Juliana enough time to kind of get in with a few things. Teresa is working hard to bring their amazing imagination into enough reality without squashing the hopes and dreams.
So good. Yeah, well, inculcating the new team members is always, first of all, critical. Because if they aren't, then they're sidecar. Don't want sidecars. And it also helps them feel the Velcro that they're contributing to. So I appreciate attention to that. I had a thought as you were talking about attention to different things. So we all know eating habits start early and then they're tough to break. So the thought I had was when you're thinking about an activity or something for the month or whatever, you might want to also think about specialized populations. For instance, families with kindergartners. If we could send out the siren to families with kindergartners, come on the third Saturday, and we are going to have 5 stations for you to show you how to do things, just to build that momentum with the family supporting good, healthy habits with the kids. And if we get them before first grade, or even sooner, I'm just thinking there's ways that we might be able to also focus on key strategic populations that if we want that mission, we got to get in there early. We got to get in there early. So along with types of things, maybe there's some strategic specialized populations we want to invite in. I thought.
No, and I think you're on to some of the conversations we've had around the Healthy Family Weight Program.
Yep.
And how that's gonna
Yep.
roll out. And we have only just briefly conceptualized in this cloud out here, programming for when the teaching kitchen comes on.
I'm feeling that whole thing, that it
Yeah.
could be a really powerful thing.
The teaching kitchen will be ideal for really being able to target segments of the community because you have a specific tool
Yeah.
to operate from.
And it's small and that's good. You know, the participation is highly limited for a reason, right? But we might also be able to blow it out a little bit with additional things where more people can come to it, whatever it is.
Yeah, and hopefully we will get a lot more direction on that need once the SOAN report gets done.
Yeah.
So we just met with them and did their kickoff meeting on Monday. So it was Teresa, myself, Henry, Juliana, and Katya. And we all sat in on that kickoff meeting with
Nice.
SOAN to make sure that we were all on the same page as far as our goals. And then that also allowed the homework that someone needs from us, which is starting to draft for the stakeholders, right? Getting different perspectives, because obviously Katya has a lot more work with some of the school, like the social workers, right? That's her group. Teresa has been talking to Amy, the nutrition gal at the school district.
Right.
And then like I talked to the sheriff.
Yeah.
And then, you know, Henry and Juliana have their own separate nonprofit groups they're working with. So we're starting to draft that down. And I think that will, I mean, that's just kind of the biggest groups. And as we build that funnel to make sure we're capturing, you know, young families with young kids, the teenage high school folk, we'll start to be able to have lists that are appropriate for that.
And then activate.
Right.
Sounds good.
When you guys were talking about it with families and things like that, I think the messaging is something that needs to be important, especially with social media and parenting, like this new generation that wants to do better, but still understand their own issues is very hard. So that message of being realistic and saying that I love the way that it says that you're not doing it alone, because I feel like sometimes, especially when you're a first-time mom, you do feel alone, you know, and Fallbrook tries to be a lot of like a village as well too, but sometimes it is hard to do that. So just with the message, being realistic and like the social media aspect to all of that, like I can tell you how many recipes and things, ideas that I want to do, and then realistically, what am I capable of actually doing?
You mean the Pinterest fail board?
Yeah.
Narrow.
But I mean, I love the kitchen as well, the idea of having the teach kitchen and being able more proactive and actually getting people there.
Yeah.
That hopefully that takes the next step to actually doing it at their house.
Yeah.
Cause that's the hard part.
Yeah. And it does have to be rolled out in small steps. You know, this is why I think it fails at physicians' offices when they just say, well, you need to exercise and you need to eat better. And people walk out and be like, whatever, like how? How? I'm a person who's never worked out in my life. What does that mean? Or, okay, well, I can't really walk around Fallbrook. where should I go? And then the idea to be able to say, well, here's an intro into what gentle fitness looks like. Here's an intro into nutrition. Here's an intro into mental health. Any one of these 4 pillars, you could put any one of the programs and your entryway into them.
Yeah.
So both messages, I think what you're both saying fits well within this.
Absolutely.
And I'm glad that we've captured that in these conversations.
I just have one comment in terms of to respond to like the youth and catching them young. Our family healthy weight program is starting, I was looking at it, it's either 6 or 7 to either 12 or 13. So we chose when picking the age to go with a younger, and not, like the teenagers we have maybe their own idea. We'll start and also being able to train them right. And so it's going to target, obesity in children and prevent them from getting diabetes. So that is the age group we're looking at.
For the first rollout,
For the first,
which will be very piloty.
Yeah, of course.
That's the curriculum that was purchased,
Good to hear. All right. So yes. Yes. And then I'm looking at the mission statement. So mission, of course, tells the what, and vision describes the highest level of the what. So to improve the health and well-being of our community through prevention, education, and partnerships that empower lifelong healthy living. I love the rhythmicness of that. Da-da-da-da, da-da-da-da, da-da-da, a 3-part mission.
And this mission statement is much more about who's being served. Our current mission statement is a little bit too district-centric in our language. So we wanted to really kind of be able to roll out the mission statement and draft the rest of our language, all of Jasmine's efforts when we start working on the annual report as well, to really make sure that it's embracing that way. So we'd like your permission to move this draft mission statement to the September board, to the September board meeting.
Mission statement. Okay. I thought you said vision statements.
I'm trying to read it in Spanish. The only part that I feel like it's hard to explain is a lifelong healthy living in Spanish. Everything else I feel like it's
And
fine.
we were gonna work with, especially Henry and Juliana, being program coordinators and being bilingual, to have this drafted so that the Spanish language conveys the same concepts.
Yes.
The words we know will be different. So that is definitely one of the things that will be moving forward when we finish mission statement, get it in both language, then do the vision statement, do it in both language. And then we're already starting to do a lot of the materials in bilingual. And again, that's the nice part about the coordinators, both being bilingual.
Okay.
And not just bilingual, but actually bicultural, so that they're using the right language. Because in theory, Google Translate will tell you how to say it.
And it'll end up talking about the comedy show in Oceanside.
Yeah,
I mean, really.
it doesn't really
So,
always work.
What do you mean I have a big mouth?
Right.
Right now in English or in our culture, how would you put like the lifelong healthy living, or especially explaining to a senior? Because it's lifelong,
Well,
extending your life.
no, lifelong is for whatever the quality of your life is from now till you are no longer alive. That is still a lifelong journey, right? And it's never too late to change. It's never too late to bring in that one small step that allows more mobility. And this has been probably, this has been the good and the bad of the chair yoga program. It has been so successful for a lot of folks who came in with some fairly significant health challenges. But going through that program really gave them a little bit more mobility. It gave them a little more confidence to move around. Those were small steps that have led to bigger steps. And so I think, even though we're talking about their lifelong maybe shorter in duration than catching a 10-year-old, the impact of the programming doesn't decrease just because the length of time. So we'll have to make sure that we capture that essence of it though, when we get that translation. Yeah. So we'll bring, the Spanish language one back, and we're more than happy to have that be appropriately wordsmithed. Because we know putting it into another language, and you two can both speak Spanish, but you're gonna come from that in maybe different ways. And we talked about this recently when you and Katya, who was it? There was one other, Patty. I think we're all trying to figure out how to say something in Spanish, but between age differences and just how you speak the language. Do you speak it in Mexico? Are you speaking it just with family? Just, you know, the stateside version of it? You're going to get those regional and different pieces, just like we do when we all wordsmith our documents. Teresa will send me something and I'll edit the hell out of it. And then if I send it to Jennifer, she's gonna cut it up. So I think that's appropriate as long as we're centering back down on the core essence of what we want it to mean.
And we're working on keeping like a lexicon of our terms, like how do we say community health and wellness center? So I have to remind the new coordinators of this document so that we aren't all trying to re-envision everything again and again.
Right.
So when we figure out how to say lifelong health, we'll, you know, like add that. And so some of these terms that are a little harder, we can have some consistency in our communications.
That is one of the nice parts too about Juliana being LVN bilingual. She knows medical terms. And while this isn't necessarily a medical term, it's got some components to it that she can add her insights to, which is nice.
I'm also noticing that the positioning statement is almost a vision statement.
It just about is.
It has that resonance to it, so you've got a good start there.
It's not quite as future focused as a solid vision statement, but it's really building us toward that. It's not putting a where do we want to be kind of piece to it.
That can be expressed in the goals.
It can.
So anyway, I was just noticing it's got a nice vision.
It's got a good ring to it.
Vibe.
It's got a good ring to it. You know, our brand promise is, again, when you read all of those, with a little tinkering, they all could be mission statements. They all could be vision statements. But we really wanted to keep them a little bit separate because how we use them, right? The brand promise is really about how we talk about it to the community. It's how we want us, how we want others to see us.
Yes. Wonderful.
So that is what we brought forward. So we'll bring this mission statement to the September board meeting. In the meantime, Annabelle, if you are open to it, we'll work on getting this into Spanish and see if you are comfortable with that translation on it. Okay, I think that'd be good. I'd love to be able to have both of those come together at the same time. I didn't want to fight too much language and then have you guys be like, no, we're gonna change it.
Oh, you guys have had much more gestation time than I had, and I don't know about you, but thank you for the creativity and the anchors and the doability, all of that.
It was a good team process. Juliana wasn't quite here yet. I think we did it a week or so before she got here. But Henry was able to contribute and bring his outside perspective. Jasmine obviously probably does the most around our messaging by trying to make sure all of our social media has the same tone, that the flyers are consistent from that brand standpoint. So she is working on making sure we have consistent fonts and colors and the rest of that packaging, if you will, that goes with brand. Right.
So will this be shown at a new website and everything and?
Spotlight.
Yeah.
Once it gets approved in the lovely September board meeting, there'll be some changes. Because there's been some certain things I've been holding off until that does tie in our mission statement. Because I didn't want to put not time into it, but money and resources when we're thinking about changing it. So
Then let it be right now. And I think you picked some great verbs.
Verbs are the lifeblood of these kinds of statements, so. I feel very good about that.
Excellent. Well, we knew that there was gonna have to be a lot of, kind of infrastructure pieces before Jasmine really sinks her teeth into website stuff, before Teresa and her team really build out that calendar. We wanted everybody on the same understanding, on the same page. We also sent this document over to, SOAN to let them know that this is the avenue that we were working towards the board. So, we'll let them know in September, like, okay, this is the official mission statement now. And then that way, as they're beginning to look for data, qualitative and quantitative, they're gonna be able to see, where does this align with how the district is promoting our initiatives?
Right.
So.
Very good. I think items, the A and B, are we confident in those? We're ready to move. Okay,
Yes.
great. All right. Board comments and future agenda items. Anything that comes to mind for you? Okay. Regarding the appearance of Sharp at our September board meeting, right?
We are still working to confirm them for September, but
They
yes,
said that worked,
he is, the 16th didn't work,
right?
but the 9th he was pretty sure, but I'm still waiting for final from him. But
Okay,
it should.
okay, and well, as the Community and Government Public Engagement Committee,
Yep.
are we thinking about any strategic invitations other than, beyond the agenda, being posted? Because this is an important moment.
Yes, but we won't have an agreement in place.
No, I'm not talking agreement. I'm talking about the beginning of the ideas. Now, I get both, I don't want it to go out too soon,
Right.
I don't want it to go too late, blah, 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 blah.
Right.
But my thought is there might be some key movers and shakers that it might be helpful for them to be here. I'm gonna leave that to you all, to you to decide. It's just something that,
And I
it's a
agree.
two-edged sword, I
Yeah,
get it, I get it.
it does make me a bit cautious.
Yep.
Because they could
Over-explain.
and or pull back entirely.
Oh.
And then we've made a community seeming promise. And then let's say something happens on Sharp's End and they go, we're just not ready to do this for another 2 years. I don't see that being the case.
But if it did, it does. It's better than we have now. The trajectory, I get what
Good
you're
point.
saying. I
Yeah.
get what you're saying. It is a public meeting though.
Yeah.
And we have raised it already at the last meeting.
Yeah.
Because we actually said the words out loud. So I'm always looking for the seeds that can get planted as the tree grows. But I'm gonna leave it to your intuition and your sense of things.
Okay, and I think once I have solid that they plan to attend, I will just kind of work with Teresa, Jasmine, as we look at our outreach efforts. How strategic do we want to make potential invitations to that meeting? Obviously, we'll let everybody know like we always do.
Yeah, the agenda is
Right,
open.
but to your point, is this a time where we stress the key nonprofits or we stress to other key leaders in the community, like, hey, you might want to just come and hear this part.
Yeah, I don't think there's anything, I mean, various people handle things different ways, but I just think there's some points of knowledge. People who use knowledge really well, and they can explain things and not overblow it or underblow it, blah, blah. But again, I'm just putting it in the ether here.
Yeah.
And whatever happens that night, hopefully it happens that night. Yay. Whoever's here, yay. Yeah, okay.
It should be an interesting conversation no matter what, because it gives Sharp the opportunity to express what they're interested in and how they would want to potentially phase some different activities,
Just like they did with us.
just like they did with the ad hoc committee.
Yeah. Okay, excellent.
Is there a conflict if You have Sharp as your medical?
Mm-mm.
Okay. I have that, that's okay. I mean, I'm pro.
It actually would be probably a good thing.
It actually,
You don't, I see what you're saying.
yeah,
It-
but
no,
you
don't
don't
get any
personally
personal
No, no,
gain.
no, no, I mean, kind of.
Yeah, but not really.
And you know, help me along.
But it helps everybody.
Correct, yes,
See,
yes, yeah.
so
that's
it's
me.
not an individual.
Correct.
It's a community.
Yes.
So you can rest easy on that, but good spotting. Good
She's
spotting
looking
on
for her
conflicts
conflict of interest.
Yes. I mean, I'm just
That
saying.
more training
I'll be
we
happy
did.
to say yes.
Yeah.
Oh, since we just updated the conflict of interest code at the board meeting.
Yeah.
Go to that. This
Good
is glad you were there.
Your radar's up. Oh, my gosh.
Well, and you know, you've been around, and we've been talking to so many potential partners that none were really the best fit up to now.
Yeah, and the community doesn't know that we've done any of that work.
I mean, we've talked about it,
But
but
not, but without
Yes.
more details, it
right, it
feels
really becomes this
ambiguous.
one-on-one conversation. Some people listen and some don't, so.
I mean, one of the reasons why I chose Sharp was because at that time I was commuting from Fallbrook to over there. And
Yeah.
it just made sense
Sure.
to have something that was right off the
Freeway.
freeway. So
Yeah.
I know there's a lot of people that are in Temecula and then right back here, you know, and
Yeah.
so you catch those two. So it
Oh, gosh.
I mean, it's a very exciting prospect,
Yes.
very exciting prospect.
Okay, so, how was the ribbon cutting?
Oh, for
Was
North
it
County
fun?
Fire today, it was good, they had a really good turnout, for North County Fire's Station 4, the Palomesa.
oh, yes, I saw that.
Yeah, they did their groundbreaking today. So Sally came, Sally and I were
Oh,
both there
good.
representing the district. They had a good turnout. They were very strategic in how they were able to get it funded, right? Because their bond did not pass.
Yeah.
But they were able to leverage a Department of Defense grant because, obviously where they're at, mutual aid, let alone the freeway access, either 15 or 76. If the military base really needed access and there's a fire, they're gonna rely on the local resource, which they do all the time,
Right.
right? So I think that it was very creative for Chief McReynolds to be able to find and fight for that funding. So he did have several or a couple of different representatives from local Marine Corps base and overall be able to talk about the importance of that partnership. So that was again very smart. They had a pretty good turnout for a, Wednesday morning.
There you go. There you go. Well, good.
Yeah.
Got trapped in a Zoom, but that's the way it goes.
It happens.
Do we think we're done?
Unless you have anything else.
We will adjourn at 6:04. Are we stopped?
We're about to be.
Yeah.